out button. So I am good to go. Welcome, everybody. I see everybody coming in. Wow, we're up to 12 people right now, and more coming. If I can get everybody to please mute your lines, I would much rather everyone mute on their own until they have questions, rather than me having to mute people. So please make sure you mute your lines, guys, to keep the background noises to a minimum. I see a few people here that I'm going to have to mute. No worries. Like I said, I just want to make sure everybody has a chance to, receive the information, receive the message. And guys, I apologize ahead of time if the if the um, if the connection is a little iffy. I'm here in Mobile, Alabama. We're in the middle of a storm right now that just passed through. I'm literally using hotspot from my phone because the internet is kind of sketchy and I don't want everybody to have to deal with that. But I am so excited. I am still seeing people coming out here joining right now. Man, this is awesome. I actually see an old high school friend of mine out here joining. So, welcome, Amy. I see you out here. I see everybody coming out. This is awesome. Man, we are going to have a good time, guys. For those of you who missed the first chat that we did, I apologize. We can definitely get you the recording to it. And, we're going to, dive into, part two of this chat with the endocannabinoid system. We have Dr. Terrell Newton out here. He is the author of Endocannabinoid Medicine and Pharmacology. Okay, this book here is amazing. If you guys don't have this book, you are automatically in the wrong. Okay, take your $8 all right, to Amazon, look up his name, find this book, and there are a lot of great things in this book. I'm really excited about it, especially with some of these changes that are happening right now, in legislation. I just want to make sure people know that there are ways to get relief despite the turmoil within legislative right now in legislation right now. So please be sure to go and look up the book and check it out. And I couldn't be more excited to have Dr. Newton out here with us. He's a pioneer in this space. Not only is he is a physician, anesthesiologist, he is also one of the first physicians to kind of get involved with all of these things that are going on with the endocannabinoid system at a time when so many are unaware. So I am thankful to know him. I am thankful for his friendship, and I would have never met him if I wouldn't have went to as an event in Colorado called NOCO. It's the largest hemp convention in North America. I'm getting ready to take off tomorrow afternoon to head out for that. So, it's going to be a great time. Hopefully, I get to meet some more great people there. So, without further ado, we're just going to dive straight into this thing. Dr. Newton, can you hear me okay, sir?
Yes, I can hear you perfectly. Thank you.
Awesome, awesome. Hey guys, Dr. Newton just stepped out of the OR, guys. You know what I'm saying? He's got the cap, he's got the scrubs. He's just now I'm joking. He did not. But I
I
just
was at
wanted
the
to take
office today, though. I was definitely at the office earlier today.
uh,
100% doubt about that. I'm ready for this
right on.
week. So, I had some patients procedures this week. Um, and actually later at the month, I'm taking a trip to visit the cultivation center and talk with the team there, do some training and things like that. So, and this is a big, important month because April is Stress Awareness Month, it's Autism Awareness Month, it's Parkinson's Awareness Month, and those are very important conditions. Um, and I appreciate you, recognizing, some of the things that I've done unrelated to the cannabis industry, which I think are equally important because I think
Absolutely.
number one, I feel like, my most important role is as a scientist and as an educator and to
Absolutely.
educate physicians, pharmacists, educate patients, caregivers, communities, so that way it fills in a gap of knowledge that
Absolutely.
we've lost in much of medicine. And there's a lot of research that's evolving and coming out. I've done my own research projects, and we'll have another one, hopefully later in the year as well. And I think it's important to number one, be a good physician. And the type of physician I am I'm a scientist and I'm an educator. MD, yes, I have that degree too. But the number one thing is to educate patients, educate communities on what are the other options, what else is available. Yes, there's
Absolutely.
procedures available, there's physical therapy, there's chiropractic, there's surgery, and there's cannabis. And so to have all the knowledge, all the options, and then you make a decision. get all the information first, and then decide which route is best for you.
Absolutely. I couldn't agree more. When I was in the military, there was a little something that we learned, because all leaders weren't great leaders. They were they just had rank, right? And, we learned sometimes in the absence of leadership, you have to become leadership, and in the times that we're in right now within this space, that is so true because there are a lot of people that just, they've either lost their way, they don't know which path to go, and with what you're doing, it, like I said, it's so cutting edge. So I want to dive straight into allowing people to chat with you and let you bring up what's important. But for those that missed the first one, I mean, what made you make the leap from traditional Western medicine over to the cannabis realm? What was that initial moment for you?
Yeah, well, I'm going to even back up before I even answer that question and say that I don't look at things as traditional and non-traditional. I know there's a
Okay.
traditional training and not traditional training, but I don't look at it that way. I look at it as, okay, let me get the full body of information, even down to technology. So one of the first things I had come across, um, or I would say had come across at some point in my Jacksonville office, is a technology that stimulates nerve regeneration. That's called
Okay.
neurogenics. I did a few interviews on that technology. I've spoken
I
on
saw those on your website. Yeah.
platelet-rich plasma, which is
Yep.
taking a sample of the patient's blood and injecting. So at some point, something becomes the standard of care, and then it moves into what's called traditional. So, like, there is a traditional way to get a form of cannabis. I don't know if you ever heard of Marinol. Marinol
Yes.
is pure delta 9 THC that's made in a pharmacy. So it is synthetic and
Okay.
it's FDA approved for nausea and vomiting. The cannabis that we're talking about is extracted from the plant. And so it's important to have that full body of knowledge to know all the options available. Maybe a patient is in a state where cannabis is not available. And so there, maybe Marinol is the only choice.
Right.
Maybe a patient is in a state where CBD is available, and maybe that might give them much benefit, without the THC, and they benefit that way. Maybe they are in a state like, so here in Florida, we have 900,000, over 900,000 patients that has their card. And so they can
Wow.
go into the dispensary and they can get, the medicine. And here, the way it's set up is, number one, I would say educate yourself, look up the statutes if you're in Florida, Office of Medical Marijuana Use. The second thing I would say to do is visit a physician that is experienced and qualified to give recommendations, and then go into the dispensary and choose your medicine. So if you're in a state where you don't have that available, you had mentioned the conference that we had spoken at. And so one
Yeah.
of the things, it was even sponsored by the U.S. Postal Service. And so I was thinking in my mind, why is the Postal Service sponsoring this conference? Like, this is like the worst. So I had to go up to their table and ask them, and they said, well, we want people to know what they can send in a mail, and what they can't sell, what they can't
Yeah.
send in a mail, what they can
Right.
send and what they can't. I was like, okay. I was like, well, can you explain to me? And I did look at the statute. So, you look at, President Obama, he signed the 2014 Industrial Hemp Act. And so there, if something had 0.3% THC and less, you could send it in the mail,
Right.
based, of course, based on your state regulations as well. But I think that, that education piece, when I look at educating myself, I don't divide it in traditional, non-traditional, or holistic. I look at it as, okay, let me get the full body of knowledge. So that way, when I talk to a patient, maybe there's a technology, so they have actually some FDA approved medicines. And I say medicine, but it's a therapy, magnets for migraines. They also have some FDA approved virtual reality treatments for sickle cell pain.
Wow.
They have a FDA approved virtual reality treatment for mental health, for depression, for treatment resistant depression. Treatment resistant depression is where a patient has tried two medicines or they don't qualify for other therapies. That's another important area where CBD is very helpful. Where different forms of cannabis, I'm sure you've heard of the term sativa and indica. Sativa happens to be very beneficial, for depression, one of several routes. And then also, if the patient is dealing with the endocannabinoid system deficiency, so their body's cannabis is low, supplementing that with CBD, that is an excellent option to see if normalizing those biomarkers will improve the disease process. So, so looking at things, but as far as my knowledge of cannabis, it was really from the patients in Vermont. That's where I started my knowledge. And also my
Okay.
aunt, she would tell me how she would take it for sarcoidosis. And then doing the research, there's some forms of cannabis that has 5 or more anti-inflammatories. And sarcoidosis is a chronic inflammation that can
Right.
often form in the lungs. And if you're reducing the chronic inflammation, you'll get improvement in that disease process. So taking notes and journaling in Vermont, the patients can cultivate cannabis. They could have a caregiver grow it for them. They could also get it from the dispensaries there. It was primarily a flower-based product. So it has really evolved since 2010 till today. There's so many different formulations. There's tablets, there's topicals, there's tinctures. If you have the flower, you can make it into a tea. You don't necessarily have to consume it by smoking it and inhaling it. It is an option for rapid relief, but taking a sublingual tincture is another route of administration. So that's how I got involved in it, and listening to patient stories, listening and documenting, journaling. Okay, you're having phantom limb pain. Okay, what's helping you? What type of cannabis are you taking? Talking to patients with depression. Some patients were thinking about, taking their own life. They were in such severe depression and pain, and cannabis was one of the tools that would help them come out of that. Patients dealing with
Right.
cancer. If you have a terminal condition, and that often causes what I call a perceptual shift, right? So
Mhm.
you still have the terminal diagnosis, but it shifts your perception in that you're not as depressed about what you're going through.
Right.
And if you see caregivers along with that, what they're going through it with the patient, and so that is another avenue of relief. Caregivers have, it's a type of, almost like a PTSD, almost like a post traumatic stress. You're seeing your loved one going through this day in and day out, and it can take a toll on you. I actually went to speak at Temple University Medical School on that, on medical cannabis for caregivers. And that's called so respite care is care for the caregivers. That's a general term. It could just be a break. It could be going out to the beach. It could be scheduling massage. There's many forms of respite care, but they asked me specifically to come and talk about cannabis for respite care. But there's so many different types and ways to approach that. Here in Florida, we have over 2.7 million people that's disabled. And we have about 2.5 million caregivers for those disabled individuals. And so it's a big issue here. We're a retirement state. We have over 20% of our population is 65 and older, dealing with Alzheimer's, Parkinson's, different types of injuries that cause disability, even some mental health issues that cause disability. And so cannabis can be another tool in that toolbox for that as well.
I love our stories of our origin stories, so to speak, are not, too much different. I am not a physician, but your origin story was kind of your mom, your aunt. Mine was my mother. My mom was dealing with, depression, anxiety issues, and stuff like that. And a friend of mine recommended it for her. And by giving it to her, seeing her conditions improve, I got curious, more curious, and, try things for myself and whatnot, and it worked. So for those out there that are frustrated, those that are, it's like, why won't these people listen to me? Oftentimes it takes someone close to them getting ill before their ears are open to receive the message. That's just how it is. That's just how it works. So just keep going, keep moving forward. And Dr. Newton, I know there are a lot of great, by the way, this is our biggest one. We got 20 people out here on this Zoom. I think the last one was like 10 or 11. There are 20 people tuned into this right now and still coming out. I know some people probably have some questions about some specific medical issues that they're dealing with. So I want to give them the opportunity to chat with the doc. So if someone wants to unmute and kind of like ask, ask directly to Dr. Newton, what does he think? Whatever you want to share about what you have going on, please feel free to do so. Oh, I see. Let's see. Who is unmuted here? Well, there was someone who unmuted, but then they muted back. So I won't call them out. I know who it is, but okay. So since I know who unmuted, I'm gonna kick this off, Doc. I'm gonna kick this off by because I kind of know what's going on, with certain individuals. I know someone who's dealing with they're dealing with breast cancer, right now. I think it's stage. This is the second time that they've had beat it the first time. It's back now. They're dealing with some they're doing radiation currently because chemo wasn't required. So in terms overall, and I know you need to know the specific type, but if there is anything that you can offer, and if this individual texts me, if they don't want to come out and unmute, if they want to text me what if they have a question or tell me anything more specific, please text me
Yeah.
and I'll relay it to him myself.
Yeah. One of the and so in the book, chapter 6 covers that a little bit, talks about some research, and also in chapter 8, there's a few clinical cases and examples of patients dealing with cancer. There was a webinar I did a number of years ago, was for the Virginia Breast Cancer Foundation, and I pulled up actually some slides of the cancer cells, and there's what's called a synergy. And so synergy is where you combine two therapies and they tend to work better than just one alone. You see this with blood pressure medicine. So you might have two blood pressure medicines where one of them relaxes the blood vessels and the other one is a water pill. You might have two types of pain medicine where one of them is an anti-inflammatory, one of them is it actually blocks the pain signal. You might have one, like acetaminophen, and you might have an opioid. So you have like these different combinations, and it's to gather synergy. And so within medical cannabis, you might have heard of something called an RSO, which is a concentrated ethanol extraction. And then you also might have heard of terpenes. And so there has been different studies. And one of the studies that I really like is it was a study where patients took 2 grams of limonene. These were breast cancer patients. And so they had a group that took the sugar pill. We also call that placebo. All of the patients eventually had surgery. So all of them had definitive treatment. But during those few weeks, the group that took the 2 grams of limonene, their breast tumor shrunk during that time. And the ones that took the sugar pill, theirs continued to
Oh
grow.
wow.
And so, what is the clinical implication of that?
Hmm.
And so, in every case is individual. So you can't say this applies to every single patient. But what it might apply to is that a patient with a smaller tumor, a smaller lesion, might need less chemo, radiation, or surgery. And so that group that took the limonene, which is 2 grams, there are case reports of patients changing their lifestyle completely. Like I'm talking about going to just juicing, just fruits, vegetables, no meat, almost, I would say, an essentially like a ketogenic diet, but vegetable and fruit based, not so much of the meat component. There are some versions of keto that do involve a lot of meat. There's some that don't. And looking at that, you will see case reports of patients getting healing of their cancer. And so when you look at something like that, which is a systemic disease, you want to take all your all your tools. You want your Navy, you want your Army, you want your Space Force, you want all your tools
Right.
against cancer. And so I would look at it as a need for a 24/7 lifestyle change when you're dealing with that. I'm not saying you have to be tortured. You can't eat stuff that tastes good. Yes, you can eat stuff that tastes delicious and great. But look among the list of the top anti-inflammatories, the top anti-cancer foods, and select which ones are most appropriate that you can stay with consistently. And
Mhm.
so another component of that is if you want to think about, okay, how can we divide and how can we think about anti-cancer foods and plant components? So one way I like to look at it as, okay, look at the top fruits, vegetables, spices, and your teas, right? So if we take the top fruits, let's just go for cancer overall. That's going to be pomegranate is one. Another one is going to be, if you ever heard of lycopene, tomatoes, right? Tomato is a fruit, but from a culinary standpoint, it's a vegetable, but it grows on a vine. So those are going to be your top two. Look at your vegetables. So that's your cruciferous vegetables. That's your broccoli, your cauliflower. For spices, you might have heard of turmeric. Turmeric for inflammation is usually around 200 to 400 milligrams. Turmeric for anti-cancer activity is going to be 4 grams to 8 grams. Look at
Okay.
black pepper. So black pepper has something called beta carotene in it. Okay, so that's your
Mhm.
spices. Now you're looking at your tea. So now your tea, now I put cannabis in that category because it can be taken as a leaf along with green tea, right? So green tea has, specifically matcha tea, has elevated chlorophyll. And so it's grown in the shade. So this plant responds by increasing the chlorophyll production. And so you could have, in some cases, and it's also ground up, you could have 100 times as much of the active ingredient. It's called ECG. Epicalogan galate is one component of that green tea. And so if you get it in the right formulation, now you have multiple tools against that cancer in different categories. You have your top fruits, your top vegetables, your top spices, your teas as well. And you can even add, like I mentioned, limonene that would fall under supplement, right? So
Right.
limonene can be extracted from lemons, limes, oranges. One of the ways it's done for aromatherapy is it's actually extracted out of an orange peel. But to get enough limonene to get the 2 grams, you have to take it as a supplement. It's not as concentrated in the cannabinoid plants where you could get enough to get that result by itself. But thankfully, with cannabis, we do have something called the entourage effect, right? So with the entourage effect, you have your cannabinoids, as I mentioned, and this is in the first chapter, and the second chapter as well. So you have your cannabinoids, your terpenes. You have a whole nother category of components called flavonoids. You have a whole nother category that's also in fruits and vegetables. And the great thing about it is you can take a variety that's pleasing to you, that's pleasant to you, and you can have a variety of anti-cancer, anti-tumor agents in different categories. So that's a great question about breast cancer, and I'll probably will touch on that a little bit deeper in one of the subsequent books. In this particular book, I did also mention diet. So if you look through the cases in chapter 7 and chapter 8, you will see not just cannabis therapies, but you'll see I mentioned physical therapies. I mentioned dietary therapies. I mentioned, a whole plethora of different types of modalities to treat patients and treat their different symptoms. But very good question about breast cancer.
Now, thank you for that. I do have another question someone asked me, and I am going to ask this question to you because this person means a whole lot to me. They text me. First of all, they said, I'm just saying they, right? They said, I'm a chicken, but I would like to know his thoughts on improving long COVID and post external malaise and gut issues involved with it.
Okay, so I would say 3 things about that. One, the first thing I would say is anytime you're dealing with inflammation, you want to focus on what is the most potent anti-inflammatory. So in medicine in general, our most potent anti-inflammatory is steroids. And so if someone is dealing with ongoing inflammation, usually from a pulmonologist, that is the standard of care. Steroids can be taken by a number of routes. So they can be inhaled, they can be taken as a pill form, and they can be taken as injectable forms as well. So, looking at something like long COVID, I would say, again, you got to focus on the individual because everyone's symptoms might be a little bit different, but the majority of them are pulmonary or neurological. And so usually it's some type of inflammation. Now, when you're looking at CBD and the precursors, so by precursors, I mean what the plant makes before CBD is the end product. So those are also anti-inflammatory. So there's one called CBGA,
There you go.
mentioned as the mother of the cannabinoids. You have CBDA, which is also a potent anti-inflammatory, works very similar to CBD. CBDA and CBD are much similar when you compare them to THCA and THC. Okay, THCA and THC are quite different, but CBDA and CBD are very similar. And if you're dealing with something like a chronic ongoing inflammation, a chronic ongoing neurologic condition, that could damage small nerves. And so some of the small nerves in the body are called the sympathetic nervous system and the parasympathetic nervous system. They do go to the GI tract. And you often see this in diabetics where they get, unfortunately, some diabetics, they get damage in their GI tract and they get loss of something called peristalsis, which is the movement through the GI tract because the nerves are damaged. So the nerves are controlling the movements, the contraction to move things through the GI tract. And so that might be another instance where you have that going on. So with anti-inflammatories, of course, a key component to that is early treatment. The earlier treatment, the better. So I can't tell you that there's a lot of research showing that cannabis is beneficial for that specifically, but what I can tell you is that these are potent anti-inflammatories. And if you look at the disease process, if you could slow down that inflammation, most likely that would give some benefit. The question, though, is would it slow it down enough to where you would notice a resolution of symptoms or not develop them at all? That's the key that we don't know yet. But if you could focus on the lifestyle component, and then as you're following up with a physician, and they can focus on, you know, within their scope of practice and experience, because you have a lot of physicians that's not experienced with long COVID. So that might be one situation where you want to get more than one opinion.
Hmm.
For something that's common, you may not need more than one opinion. If you have migraines, if you have a back strain, those are very common. You know, most of us as physicians are going to see that on a regular basis. Now, when you're talking about something that's less common, like a more rare disease or long COVID, now you might have one doctor that saw 10 patients and another doctor that's seen 12 with it. And because there's not a lot of experience, there's not a lot of data and research, you might get more than one recommendation. And so sometimes you can get more nuggets of a potential benefit from visiting more than one doctor that's specializing in long COVID for the treatment.
Now,
But great
now
question.
one of the things that I did for this individual, I sent her the study from Oregon State University where it mentioned those two specific cannabinoids, CBDA and CBGA, so she could review it herself first. And then I actually have access to a tincture that has those two cannabinoids in it. So I sent that, to her as well. And she's been taking that, and she just replied. She said, "I've been told I've developed autonomic dysfunction and POTS with long COVID." So, yeah,
Mhm.
that's that's where she's currently at with it. But I'm glad you mentioned those two specific, cannabinoids, because, like I said, whenever I see research on this stuff, I blast it out there to people so that they're aware.
So that's a great situation where you would also bring in a neurologic opinion, right? So you have a pulmonologist, you have a neurologic, and that might take a little bit more research to see which neurologists have experience working with long COVID.
Mhm.
Might see. Now, I would say, of course, we have a much longer research base on POTS because that's been around for decades, if not longer. So, as far as incorporating treatment for that, you might even have someone separate that you see specifically for the POTS.
Yeah.
Yeah. So, but that's a great question. Mhm.
Hey guys, I know a few of y'all know my cell phone number. Everybody's not going to text me your questions and your side stuff. Like, if you got something, please ask it to the physician. Don't. I'm not a medium. Like, just hit the unmute button on your phone.
What I'm
Or
curious to know, I want to know what everyone's favorite chapter is. That's what I'm.
yeah. I can tell you my favorite chapter. Probably definitely chapter 2, as well as, like I said, I'm in chapter. Like I said, I'm on page 65. Not sure what chapter, but chapter 8.
So
Looking
you're
at
getting
the
chapter
case studies and whatnot.
basic.
Yeah, I love that. Um,
I've gotten a lot of great feedback from chapter 2, a lot of great feedback from chapter 3. Even this past weekend, I was talking to someone on Saturday about chapter 3. For me, if you ask me one day, I might say, 7 and 8. You ask me another day, I might say 9 and 10. And one of the things that I really found, by the way, I've written 10 books. This is the
oh
first one
wow.
that I published. This is the first one that I
Okay.
published. I've written
Okay.
books on anesthesia, books on pain management. My first one was when I was in my pain fellowship. This was in 2011, 2010. I wrote a book on 100 treatment plans, and these were all integrated. These were physical therapy, even using physics, interventional, medical. So that's where I classify cannabis under medical treatments,
Mhm.
psychiatric, and surgical. So during my pain fellowship, I rotated with neurologists, with orthopedic surgery, neurosurgery, and I did 2 palliative care rotations as well during my pain fellowship. So I have a book. It's called 100 treatment plans, but actually there's more than 100 in there. I ended up doing something like between 130, 150. Um,
Mhm.
but the reason I like this book, I feel like it's the best book that I put together. And I think just having that experience of writing so many books and writing so many articles, I think it prepared me to write this one. And you see that the audience is medical doctors and pharmacists, right? Endocannabinoid medicine and pharmacology. But I have seen a pretty big split that you have nurses, you have community educators, you have caregivers that have been giving me good feedback. You have legislators, you have people in different departments, different government departments that have given me some feedback on how they found the book useful. And if you see the symmetry in the book, you'll see it starts out with an introduction. It all comes together in chapter 6, where I talk about evidence-based therapeutic applications. So that's where I actually go into the research that's published. And I purposefully left out my research because I didn't want it to seem biased, like I'm biasing someone toward the research that I've done personally. So
Hmm.
I did not put that in there because I wanted you to see that there's so many other avenues, and I didn't take a bias toward US based research or Canada based or Israel based or Italy based or France. So you'll see a big mix in the whole book. Some of those research studies, so long as it was a well developed research study, I felt it was good enough to include in the book. And
Yeah,
then the
that's
last
what I
four
love.
chapters,
That's what I love. Yeah.
you might not see that in any other similar book. So I did cases. So it's basically educating caregivers, doctors, pharmacists, nurses on what's the basis, what do you need to know before you dive deeper into the research, so you have a foundation. Now in chapter 6, I'm giving you that research, and now in chapter 7 and 8, we're going to practice applying that research. And now we're getting you ready. We're getting you ready to go into the clinic, right? So the last two chapters are, this is what the patients are going to ask you, and then the last
Yeah.
chapter, this is what your colleagues are going to ask you. This is what other doctors and physicians, pharmacists are going to ask you. So you'll see it's almost like a book. It's almost like a master class for doctors and caregivers, to anybody that's up to that challenge of educating patients, giving recommendations, to interacting with patients on that level. And then you have to interact with your colleagues, right? So you want to have intelligent conversations. So the book essentially, it almost has stepwise gets more and more, you know, upgraded, right? So it gets upgraded. So you get
Hmm.
the foundation, you got the research, you got the cases, and now you have the conversations, right? So that's the frequently asked questions.
Hey, Doc, I know you got another question out here. I'm going to unmute. My cousin has a question. Actually, I'm going to unmute real quick. I think I am. I'm trying to let's ask to unmute. I am hitting it, but it is not liking me
Can he
right
type them
now.
or she type them?
Uh, well, I disabled the chat function. So the question is, ask him how hemp helps sarcoidosis.
So when we look at cannabis, there's different categories. And so one category is one way to classify, it's not the only way to classify. One way to classify cannabis is on the THC percentage. And so when you look at hemp, that has 0.3% and less. And then if you have 0.3 or more than that, then you have medical marijuana or cannabis, medical cannabis. So that's one way to separate that. Sarcoidosis is a chronic granulomatous disease. So it's a disease of chronic inflammation. So what's a granuloma? Granuloma is a benign tumor. So the inflammation builds up and there's deposits. I don't know how many people have heard of bone spurs. Have you ever heard of a bone spur?
Hmm.
So bone spurs is a chronic inflammation that you see around the joint. And when that inflammation builds up, you start to see calcium deposits, right? So there's many different types of chronic inflammation. A bone spur is one type. Sarcoidosis is another type. And so it forms benign tumors, benign meaning non-cancerous tumors, and it can build up in any tissue in the body. And so because cannabis, many chemovars, so many chemical varieties can have 5 anti-inflammatories, this is how the cannabis plant can help. So you could have the cannabinoids. So for example, CBGA, right? So that's the mother of all the cannabinoids. All, but I mean, maybe there's 2 that's not made that pathway. But for for our purposes, to general purposes, it makes the CBD, which is one of the most important anti-inflammatories, THC, and with hemp, there's not much THC, so it's not enough to feel high, altered. You don't have that dizziness or psychoactivity. But there's other cannabinoids. So there's over 100 cannabinoids in the plant, over 100. But then there's also terpenes. Terpenes is what gives the cannabis plant the different scents, the different colors. And those are also anti-inflammatory. Some of the most potent ones in that category, and so this is in chapter 2, beta carotene. It interacts with CB2 receptors, so it works very similar to CBD, how that mechanism at that receptor, at that particular receptor. There's another one called alpha pinene. Alpha pinene is found in pine trees. that is also a potent anti-inflammatory. So if you break that down, you could have one plant with 4, 5, or even 6 anti-inflammatories. So that's how it can help with the chronic inflammation that's going on with sarcoidosis, because now you have many low doses of anti-inflammatories in one medicine. And that could be
Mm.
taken in drops, that could be taken in capsules, there's edibles, gummies. So there's a variety of ways that the patient could take their medicine, and it's reducing the inflammation.
Now, one
And
thing I'd like to add, if you wouldn't mind, real quick to what you're saying. I noticed you mentioned the tinctures, you mentioned the gummies, you mentioned, various routes. But for this particular one, you didn't mention smoking, because by setting it on fire or pyrolysis, you're actually metabolizing or converting, some of those cannabinoids. So you're not getting the CBD-A or the CBG-A. You're getting the CBD and the CBG, which is different from what you're explaining right now. And a lot of people don't even realize that.
so when you heat up something, it can be converted. So it can break down because of the heat. And in some cases, you can lose some of the medicinal benefits if something is heated too high. It starts to break down the same way as if you cook your vegetables too long, you start to lose some of the nutrients in the vegetables because of the heat exposure. These
Mm-hmm.
components, they tend to enter into the air, so they tend to vaporize at lower temperatures. So, or if you leave them out, let's say you had the medicine, you left it out on the counter. Here is probably 80 or 90 degrees in Florida right now, so you can lose some of the medicine over time. It gets converted by the aging process and with the heating process. So if you have it sitting out for 6 weeks, let's say you go on vacation, you come back, and it might be a totally different medicine because it wasn't stored properly and there was a breakdown of the medicinal benefits.
Mm-hmm.
Mhm.
Yep. You have another question. My buddy Theo Alexander from Hawaii just unmuted, and he has a question for you.
Gentlemen. Hey, JJ, thanks for putting this platform together and continue to build the knowledge base that we need to get a better grip on and access to these
Yeah,
wonderful
man.
medicines that we don't know about. And Dr. Newton, I commend you on writing these books and being out here for us and actually hearing from a clinician what these things are doing for us, being knowledge about the endocannabinoid system, as well as how to use the cannabinoids. But my question is, when it comes to cancer treatment or any chronic disease treatment, what is your preference in treatment protocol? Do you prescribe synthetic cannabinoids, as you mentioned, FDA, Epidiolex, we have Marinol, we have Dronabinol, those things we know about in the formulary. But oftentimes I talk to physicians or clinicians, and they're clueless when it comes to what's in the market versus synthetic-based drugs. What is your protocol when you talk to your patients about what they should take one over the other, if you don't mind asking?
So if I got the question correct, it was for epilepsy patients and cancer patients. What's a good protocol for the recommendations?
Yes. Do you prefer pharmaceutical over nutraceutical? FDA approved synthetics over what even JJ has available when it comes to the products he's talking about?
Well, I would say the key with any product is going to be something called the certificate of analysis, and that's just to ensure that the safety of the product. And the best resource for that is a third party. So it's a certificate where a third party, so an independent company, has tested the product before the patient consumes it. And it's for several reasons. One is to confirm, okay, it actually has what's on the label. And then number two, it doesn't have things that's not on the label. So let's look at vitamins, for example. Let's say you went to the store and bought vitamins. Vitamins are not necessarily, is not a regulated industry. So what if you took a vitamin, it said 100 milligrams or even 1,000 milligrams of vitamin C, and there was no vitamin C in there, but it was all vitamin B. So there's some diseases where if you take too much vitamin D, it can cause blindness. So the key is the certificate is to have a product that is independently tested and evaluated. In the FDA, there's a different regulatory standard in the FDA. So in the FDA, we're talking about good manufacturing practices. And so, there is another standard in the FDA. as far as looking at the research studies, when you're talking about cancer, most of the patients that are taking cannabis to slow the cancer growth, and of course they're working with their physicians, that's usually something called an RSO. So that's usually based on the state program for licensed dispensaries, which there's now over 35 states that are licensed. When you're looking at something like epilepsy, so there is a medicine that's FDA approved for epilepsy. It's called Epidiolex, and it's available in 100 milligram per ml. It's basically a sativa, but you have that is only FDA approved for rare seizure disorder. So if somebody has an acquired seizure disorder, they may not get that recommended to them from a neurologist, because the only way to get it covered under the insurance is you have to have Lennox-Gastaut or Dravet syndrome. There's another indication called tuberous sclerosis, which, if you don't have one of those, the neurologist may not recommend that to the patient. So then you have to go other routes and what's available. So you might have a CBD tincture that's available in that case. And so you're basically going through, this is like your backup, because the neurologist isn't prescribing it to you. It is FDA approved, but it may not be FDA approved for that type of epilepsy. It's approved for other types of epilepsy. So then you go to what's available. And so it's all going to depend on, number one, get the safest product, make sure there is some standard of safety, that there's no pesticides in there, there's no heavy metals. So that's your certificate of analysis. And then you just have to kind of go through what's available in your area. So whether you're in, North Carolina, they don't have a state cannabis program. Here in Florida, we do. So usually, what patients might do is go get their card, and we do have recommended, we have over 2,200 physicians that's certified to give recommendations. Um, so it really, I would say, varies where you're located, but the key is to get consistent dosing. Is the certificate of analysis is the key. And usually that's taken in a tincture, by the way. For the RSO, for the Rick Simpson oil, usually that can be taken as a syringe. It is also available in capsules and other formulations, but the highest concentration is going to be the syringe. And it's very potent. So a rice size amount of that might have between 35 to 50 milligrams. So that's dosed by 0.05 mLs or so. It's very potent, and patients have to build up to that tolerance. You have to build that up. Mm.
The article you speaking of. The reason why I asked my question is that some patients they do get a prescription from their doctor for maybe Marinol or Epidiolex, and then they have problems getting the access to it at the pharmacy level. They want the insurance company battle without filling that prescription a lot of times. That's why I was asking with dispensaries and the RSO. I do understand that profile, but some patients are not willing to go that route. That's why I'm saying, what is your medical advice as far as talking to patients about what's the best approach as far as access and the safety of the medicine? So I do appreciate you talking about the COA. I'll sign off here.
Yeah, it just hasn't. Yeah, some states it hasn't passed yet. Where I trained at, where I did my medical school, my anesthesiology training there in North Carolina, it hasn't passed yet. And so they don't have access to get a card. They don't have physicians that's educated on recommending cannabis. In Georgia, they do have a medical cannabis program, but they don't have some of the more potent products that we have here. So here we don't have a specific limit on how concentrated to make the medicine. So with CBD, there's not a limit anywhere on concentration. So as I mentioned, the 100 milligram per ml of the Epidiolex in at the conference where me and JJ had met, when I talked to the U.S. Postal Service, they sponsored the event because they wanted someone to know what can be sent in the mail, what can't. And so, when you're looking at the 2014 Industrial Hemp Act, that falls under the, that category, the 0.3% or less, if you're talking about something for, where CBD is indicated. So if you're talking about seizures or nausea or pain, and you're in that category, each rule and regulation is different. And I think that the most important thing is just really just to educate on the options now. Okay, you might have to access it, through a different state sometimes. So that's called a medical refugee. So you have some parents that move because their kids have seizures and they want them to get this medicine. You know, they're not getting prescribed Epidiolex, so they move to another state sometimes. But with CBD, you don't think generally you have to do that anymore. You know, so that kind of the times has changed for that. But as far as the THC, that's the part that's the more regulated side is the THC content. Mm-hmm.
I appreciate
Yeah. All right. So, you know, I had, we're about a minute over. So I got some things I got to take care of, but I wanted to say, JJ, I appreciate you, you know, getting things set
So
up.
real quick, guys, I'm gonna. Yep.
All right, go ahead.
Absolutely. Sorry, guys. I know the connection's a little choppy. I've got some more rain going on here in this area right now. I think it's kind of messing with the signal a little bit. Dr. Newton, can you still hear me okay?
Yes, thank you. Appreciate it.
Okay. Can you hear me okay, Doc?
Yes.
Okay, all right. Sorry. Yeah, I got some rain going on right now in the area, so it's kind of jacking with the signal a little bit. But thank you so much for coming out here, giving us, some more of your time. And lastly, before you go, if anyone wants to contact you directly, how do you want them to get in contact with you?
Probably the best way is through my website, which is my first name and my last name.com. So TERELNEWTON.com. So if anyone is interested in, you know, any of the events, I do have an event calendar on that website, and it also has my contact if you want to shoot me an email. I'm also on LinkedIn, so you can connect with me that way too.
Awesome. Awesome. Well, Doc, thank you so much for coming out here. Guys, please get with Dr. Newton. Please make sure you get a copy of his publication. Doc, hold it up. I got my camera muted to save bandwidth right now, but hold it up one more time so they can see it. Go find that bad boy on Amazon. It is the truth, guys. Please make sure you get that, explore it, dive into it. Dr. Newton, we thank you so much for your time, energy, effort, expertise, research in this space. Please continue to blaze the trail, sir. And if there is anything that I can do, please let me know. Guys, thank y'all so much for coming out here. Doc, if you need to disconnect, please go ahead and do so. I'll try to wrap up, with everyone as best I can. Hopefully, they don't ask me anything crazy. And we'll see you soon.
All right. Thank you.
Okay. Yes, sir. All right, guys. Well, there you have it. You guys were able to hear directly from, Dr. Newton. I'm stoked that you had a little bit of time with him. Like I said, my apologies for the signal, you at the very end. Um, if you guys have any miscellaneous, no, but like I said, I am not a physician. I am not going to pretend to even be a physician. I'm just a dude next to a dude trying to play another dude. And I try my best to, when I find subjects that are worth talking about, I try to bring them, I try to get you to the well to get the water instead of hearing it from, everyone else, different sources and whatnot. So with that said, I hope this was good for you. Does anyone have anything for me before we disconnect?
How do we get an
Is there
autograph
any?
copy?
What's that?
How do we get an autograph copy?
Autographed copy of the book?
Yeah.
Well, the dude who could have told you that just got off the line, brother. um, is there any one thing that I was able to pull up? If it will help anyone. Is there anyone who actually needs to see? Like, I know we have varying levels and varying degrees of people that are out here. Is there anyone who actually needs to see what a COA looks like, or talk a little bit in more detail about a COA? Because I know I can do that if anyone needs that. If so, please unmute, say yes or something, and I can try to pull one up, share it with you, and we can kind of dive into that a little bit if you would like. Anybody? Anybody at all?
Hold
Going.
up, JJ. I think that'll be a good training real quick.
Okay. All right. Well, let me go here and I'm pulling up slides. I'm gonna go here and share. Let's go here and share screen real quick and hit share. Okay, Theo, can you see my screen?
Yes, I can see it.
Okay, all right. In order to preserve bandwidth, I'm going to go on here and I am going to mute my video. So hopefully it doesn't eat up too much bandwidth, guys. And I'm scrolling through this is my present when I travel around and actually teach what I teach. This is, well, what is going on? I don't know why. Oh God, really, really, what happened to my presentation? Oh, I think I know what happened. Um, let's see here if I can pull this one up. Nope, it's not gonna let me pull this one up right now because I downloaded. Hmm. You got here. Let me stop the share for a second. Bear with me here. I'm going to see if I can actually find a COA because it's in my presentation, but I'm using a different laptop for this presentation right now than the one that I normally use. And this one, it does have, let's see if I can, let me do a search real quick for COA. Let's see. Let's see what, let's see what's in the cannabinoids presentation here. It actually pulled up. We may, uh, I'm trying to see if I have a COA readily available for you guys. Let's see, here we go. COAs. Isolate, yeah, that'll do. No, I don't want to use that one. It's a little wonky. I do have some COAs here. So let's see. Yep, we'll use this one. Okay. This will get the job done for now. All right. It's not the ideal one, but it's actually one. Okay. Theo, can you see my screen?
Check. Yep, I can see it.
Okay. All right, guys. So this is what's known as a certificate of analysis or COA. Now, when you're standing at the gas station or you're standing in a dispensary or a smoke shop or whatever, and you want to know the quality of what you're holding in your hand, that product should have a QR code somewhere on the product. And you can take your phone, pull it out, scan that QR code, and it should lead you to something like this that says certificate of analysis. And on the certificate of analysis, when you pull it up, this is actually the report card for what you're holding in your hand when you're standing at that counter. Okay. And if you look here, let me pick a color. If you look here, when you pull it up, you have these different cannabinoids. Now, just because it's something listed here, it doesn't mean it's gonna be, in what you're holding. The key is to, let's say we're talking about, delta 9 THC, right? So delta 9 THC is listed here. So basically, you come over here, right? Right here, it shows a number, and right here, it shows a number, okay? That's the percentage of delta 9 as well as the milligram per gram amount of delta 9 in that product. Now, if you see ND, ND means none detected. And basically, ND or none detected means that there is nothing detected. The analyzer couldn't read it. When they tested that product, the analyzer that they tested it on couldn't pull up or couldn't detect any. So it's below the detection limit of that analyzer. That's why it says none detected on it. So just know, when you're standing there and you're trying to determine, what a product, and the I'm not gonna bash everyone. This is not a goal to bash people. This is just me being honest because oftentimes when you're standing at the gas station, all right, and you're talking to the gas station attendant or you're talking to whoever, and you say, "Is this a good product?" Their response is going to be, "Yeah, a lot of people buy that one," right? But it doesn't tell you the specific cannabinoids that are in that product that you're currently seeking at that point in time. So you yourself as a consumer need to know how to pull up a COA yourself and actually look at the certificate of analysis for the individual cannabinoids that you're looking for associated with the conditions that you're trying to relieve. Now, the reason I know this, guys, I used to own a cannabis testing laboratory myself, Veteran Scientific Laboratories in San Antonio, Texas. That was my lab. We were registered with the DEA for handling controlled substances. You know, we were ISO accredited, you know, all that good jazz. So that's why I kind of know about COAs and how they work. And that's why I know about, you know, post post decarboxylation, when you set it on fire, how it metabolizes, you know, some of the cannabinoids and things like that. So, like I said, you know, Dr. Newton has done an excellent job with his book of identifying, you know, which cannabinoids are helping with certain conditions. But if you're standing there at the counter and you don't know how to look at the type of cannabinoids that are in that product, you're going to have a problem. Also, with those COAs, you know, CBD, CBDA, CBG, CBN, those are all cannabinoids. Now, he mentioned something called limonene. Okay, limonene is a terpene, but if they've done their job properly with the COAs, not only do you have a cannabinoid, you know, result, but you also have a terpene, you know, profile on that COA, and you also have testing for heavy metals and pesticides as well on those COAs. Those are what we call full panels. Okay, a full panel COA is not only going to have cannabinoid content, it's going to tell you terpenes. It's also going to tell you if residual solvents, heavy metals, or pesticides are present, if that product that you're holding is clear of all these things. And then you have something that's done in the industry, which is known as just a potency test. Now, if someone is selling you a product for consumption, it should have a full panel, meaning not just the cannabinoids. It should have cannabinoids. It should have terpenes. It should have, you know, heavy residual solvents, heavy metal testing on that full panel and not just a potency. So if you're standing there and you're literally holding something and you're looking at a COA and all you can see is a potency where all they've listed is the cannabinoids, drop that product, run for your life, don't buy it. Okay? Do not, I'm telling you right now, and people can contact me, they can criticize me all day long because my maker sees exactly what I'm saying to y'all right now. And I'm telling you straight up, don't buy a damn thing if they don't have full panel testing on it. The reason we're having the problem that we're having in this space right now is because people have gotten away with just doing potencies only while the government wasn't paying attention, and they were selling products with just potencies. So no one knew if these products were clear of residual solvents, heavy metals, pesticides. Okay. And they were selling these products to people not knowing if they were clear. Well, now they're starting to tighten the screws up a little bit on this industry, and people's, you know, ethics are getting a lot better. So therefore, you're starting to see full panel testing emerge more and more. And that's the way to go when you as consumers are standing there trying to find products that are suitable for your conditions. So I hope that little bit helps, because if you understand that key right there, man, you can save yourself a lot of time, headache, and money. Because if somebody is selling you a product that says CBD on it, but it only has one cannabinoid, CBD, all right, there are over 100 cannabinoids in the plant. And they're selling you something that's made out of something called isolate, which is isolated down to just the CBD component by itself. And that is not full plant medicine. That might not even be the only cannabinoid that you need. So whole plant medicine is truly the best medicine. And like I said, if you're dealing with specific things, there are certain cannabinoid concentrations that you actually need access to. And if you don't know how to read a COA yourself, you're setting yourself up for failure when it comes to just going in and buying a product that says CBD on it, because that's not necessarily the best product for you. So I hope that helps a little bit. Does anyone have anything else before we disconnect? If so, please
So
unmute.
I just,
I'd love
yeah,
to hear from you.
yes, I just unmuted. My name is Dr. Elmer Alexander.
Yes,
I do
sir. How are
certifications in
you?
Georgia. I'm doing fine. How are you? I love this platform, and I really appreciate
Good, good. You said you're in
information.
Georgia, sir?
Yeah, I'm in Georgia.
You said you're in Georgia?
Yeah.
Okay, all right on. Thank you so much for coming out.
Well, thank you, thank you. You're speaking from a lab standpoint, and I'm interested if you would just share with everybody, and even myself. There's a big push now against Delta 8, and
Mhm.
we know that it has certain effects that itself has a positive effect on the body. But can you speak to the to why there's more regulation about it, as opposed to them talking more about the Delta 9 itself.
Absolutely. And if you want, please, feel free to, contact. Let me give you my email address. So please write down my email address, and what I'm gonna do, or I'll give you my email address, and then I'll also send you my Hemp 101 seminar, because I really dive into that a lot. My email address is James, James, at jjgro.com. Please do not put a W on the end of the GRO, because I will never get it. Once again, James at jjgro.com. Now, Doc, you bring up an interesting subject. It's a hot button topic right now, in this space. And I will start off by saying Delta 8 THC, it is naturally occurring in the cannabis plant, but in very minuscule trace amounts, not enough to keep up with the demand for all of these products that are emerging on the market. So there are a few people who do formulations and extractions that know how to get it naturally, but that's not the masses. They're exception. They're not the norm. Okay. And the thing about that is, what they're doing typically to synthesize the Delta 8 is they're taking CBD isolate, which is a white powder substance, and they're adding things to it like hydrochloric acid, sulfuric acid, and they're cooking it at X amount of temperature for X amount of hours to reverse engineer that CBD. Now, that's the same way they cook meth. Okay. Those are the same things they use to make methamphetamine. So, therefore, after they've basically cooked it, right? If you don't know how to read a COA, or you don't even know what a COA is, you're out here buying Delta 8 products that may have not been full panel tested to ensure that stuff has been properly evaporated, or products. And that's a big problem within this space, is that's happened for, a long time, because within the definition of what is hemp, okay, I'm not going to read the definition verbatim, but to make a long story short, it left a little bit of a loophole, and a lot of people for a long time have taken advantage of that loophole in the definition. Well, now what the legislators are trying to do is they're trying to go and close that loophole. They're trying to take that loophole out, and people are pissed. Okay, people are pissed about them trying to take Delta 8 out. A lot of people are saying that they're killing hemp. They're killing the hemp industry. They're not killing it. They're trying to take it back to center, what it was supposed to be. Hemp was never meant to get people high. Period. It was not. You want to get high with hemp, you got to go build a rope and climb it. That's as high as you're supposed to get. But because of a loophole, people have been able to capitalize that on for a long time. They've been able to make a lot of money, and now they're upset that the definition is changing. And that's why you're seeing a lot of resistance, a lot of kickback and whatnot. And I'm not saying right, wrong. Look, y'all, I'm part owner of a medical marijuana grow myself. Okay. So I am all for legalization. Let it fly. Right. But I understand the times that we live in. And that's why my personal product line, Active Duty RX, it's a THC free CBD line with no detectable levels of THC, but we put extra CBG in our products. We do that because the CBG, as Dr. Newton was saying previously, the CBG has the ability to target a lot of the same receptors in the body as THC. So if I were king for a day and I could wave my magic wand, what I would tell people is, let's go the non-THC route first with treatment, because not everybody wants to get high. Some people just want medical relief of symptoms. And if you do something that does not have THC in it, and it has extra CBG, and it's not getting the job done, okay, now you need to go get a medical card. Because, see, a lot of people are getting these medical cards and they're not understanding that you will still get fired by your employer if they are testing for THC. Doesn't matter whether you have a medical card or not. If it's in there and you test positive for it, you're going to get fired. You're going to have a problem. So going back to your question about Delta 8, that's the problem right now. It's a loophole within the definition, and it's in the process of changing and being tweaked, and people are not happy about it, because Delta 8 will get you high. And right now it is classified as hemp. Now, another thing you have to look at too, depending upon the state that you're in, because there's the federal definition of hemp, and then you also have your CSA, the Controlled Substances Act for your state. So you have to check your local CSA, your Controlled Substances Act, to see what their definition of hemp is too. Because I know in the state of Texas, it mentions the synthetic cannabinoids. Okay, those can't be included. So in the state of Texas, if it is a synthetic cannabinoid, you can't call that hemp according to the Controlled Substances Act. And that's where a lot of people are having problems. And they've got a big hearing coming up in Texas, tomorrow, about Senate Bill 3, So a lot of controversy right now around Delta 8. And I just tried my best to give people the facts without hating me, because I have had people call me a fear mongering CEO about publishing, stuff and things. No, man, I'm just trying to tell people the truth, give people the information, and then you go do what you will with that information. But that's the overall layout right now. And you had an excellent question.
So JJ, follow up on that. Can you speak to why it's a problem? Okay, so you said that Delta 8 is found, in a plant. So Epidiolex
Correct.
is also a synthetic. So
Correct.
why is the synthetic um, Delta 8 different? What kind of effect does it have on the body? So why are we so concerned about the fact that it's a synthetic? I mean,
Well,
theoretically it should be pretty close. We know it's not exactly close, but that
right,
difference, it's causing a problem, and this is why there's all this legislation and people are up in arms about the fact that it is there. Can you speak to that?
right.
Yeah.
Yes. So basically, so Epidiolex is CBD based, non-psychoactive. Charlotte's Web, that's where all those medications and whatnot came from, was because of that. It's non-psychoactive. It is synthetic, but it's non-psychoactive. The problem is, one, the psychoactive component associated with Delta 8, and two, the lack of regulations in terms of testing. Because like me, I wouldn't have an issue with Delta 8 if it was properly tested to make sure that it was free of all those residual solvents, heavy metals, pesticides and things like that. So if it's properly tested, I think the masses won't have a problem with it. The issue is it hasn't been that way in the past. And one thing I know about the government from being in the military for 21 years, whatever we decide right now, the government is like 3 to 5 years behind by the time things get implemented. So the issues that we're dealing with today are because of problems that occurred in the past. A few years from now, it'll be different. But for the time being, that's the layout. It's because it's psychoactive, and also because it hasn't been properly tested. Now, what the industry is asking for is they're asking for better regulation of it. Don't throw the baby out with the bathwater. It can still be used. So maybe we don't call it hemp anymore. Maybe we move it over, to, with marijuana, because that's psychoactive. That's what the goal is. The goal isn't to get rid of Delta 8. The goal is to get it somewhere else so that it's not called hemp. And that's what everyone is currently up in arms about. And I'm just kind of watching these battles go down back and forth. And I'm just like, man, I really don't have a dog in this fight. I understand it, you know, but I think, with so many people being employed and not wanting to lose employment, because if you think the government is bad, I mean, look at these local HR departments who haven't updated their rules and regulations and their guidelines in forever. You're going to have a lot of people that are losing their jobs, and those HR departments need to do a better job of updating their definition of cannabis, because hemp is cannabis, marijuana is cannabis, apples and oranges are both fruits. So when an HR department puts cannabis in their regulations, I'll give you, for instance, the military. Like the military, DOD wide, they have a policy: no cannabis on a military installation. So when they're saying no cannabis, that is putting hemp and marijuana into the same pickle, right? Well, when we switch gears and then the government figures out that things like hempcrete can be used to house us, that's mold resistant, pest resistant, fire retardant, all these amazing qualities of hempcrete. And then the military wants to build structures out of hempcrete on military installations. Well, hold on a second, Doc. You just said no cannabinoid or no cannabis-based products on military installations. Now you want to build a building out of it. You see what I'm saying? So there has to be some lineation or some distinction done, to make it right. So that's the problem that we're currently facing in this space. And a lot of people who've made a lot of money, they don't want to see Delta 8 go away. They don't want to see it reclassified. They want to see it stay right where it is. But it's causing a lot of turmoil and a lot of issues. Does that help?
Yeah, absolutely.
Okay.
It's a thing right now in Georgia because they have now eliminated any drinks with it, and they've been going at it pretty hard. And it's a little bit unfortunate. I do the medical cards, and so I understand that end of it, but I understand the investment that some of these small companies have done. They put a
Yes,
lot of
sir.
money into their products,
They have.
um, and some of them are attempting to do the testing. But as you said, one of the big problems is this: they're mass producing the Delta 8,
Hmm.
and there's just not that much in the hemp plant itself. So you have to go
Right.
to a synthetic base, and I don't know that they're doing enough of the third party testing to make sure that the adulterants aren't in there. And when they've looked at like even gummies across the country, they found over 200 different chemicals in different states
Yes,
that
sir.
were not supposed to be there, that had nothing to do with CBD.
Hmm.
So it is a danger to people for sure, because what they don't realize is that when you concentrate these products, you're not just concentrating the Delta 8 or Delta 9. You're
You're concentrating
concentrating the
absolutely,
pesticides too, and
absolutely.
all the other adulterants that are in there. So
Yeah.
it's not like you're just getting a little bit here and there. You're getting a concentrated product of everything, and that's what's dangerous to the body. So, uh,
And and you touch on some great points. Man, I hope I make it to Georgia soon so we can actually have a conversation. um but a lot of people jumped the gun. They started doing things during wild west times, and now they've made so much money that it's become an issue. And one of the things when we talk full panel testing, and I can speak on this because I used to own a testing laboratory myself. When we talk full panel testing, that's done on HPLC or GCMS, mass spectrometry analyzer. That is a $850,000 piece of equipment by itself. Versus that's for full panel, right? Versus a potency tester, which you can spend $13,000-15,000 on used and refurbish it. So 13 to 15, maybe $20,000 if you want to get crazy for a potency analyzer versus $850,000, right? So that's a huge difference in test prices. So when we did potency tests, we were charging $50 for potencies. But when we did full panels, the price was 300. So can you imagine being a manufacturer of products, and every time that you manufacture a product, okay, even when you're tweaking, because it's not like you're going to get the formula right the first time, right? Every time that you tweak it and send it off for testing, can you imagine having to spend $300 every time that you tweak it because the THC wasn't high enough or the CBD or whatever wasn't high enough? That's a problem. It's a tremendous cost. So who absorbs that cost? The consumer or the testing laboratory? That's so a workaround to it is, and this is what we did for people all the time. Hey, when you're in formulation phase, just do potency testing because you're tweaking your formula. But before you decide to that this is right, we're going to move this over to consumer products. You got to do a full panel on it. If it's going down somebody's throat, you got to have a full panel on it. The same thing in the field when the plant's growing in the field, right? Because before it was harvested, and this is when I was in Texas, um, you had to have you had to make sure that you were below 0.3% THC at all times. And it was total THC when it was growing in the field, right? So before you had that one formalized test by the state, people would do their own individual potency tests prior to that to monitor the THC levels as they creeped up. And then once it got around 0.2, now they would call the official guys to come out and do the official testing, and they would still be under 0.3. But see, here's another thing that a lot of people don't realize, and you have to watch this state by state, is because when the plant is growing in the field, they're concerned about total THC, but because that falls under the Department of Agriculture. Okay. But the minute you chop that plant down, it was no longer under the Department of Agriculture. It switched
Hmm.
over to Department of Safety Health Services, DISHES.
Oh,
Okay.
wow. Hmm.
And DISHES rule was 0.3 Delta 9, which is different from 0.3 total THC. You see what I'm saying? So DISHES decided, and this was Texas, guys. I'm just telling you what happened in Texas. The DISHES decided to follow the letter of the land federally, which was 0.3 Delta 9. The Department of Agriculture decided to do 0.3 total because that was a stipulation that came out with the USDA. Okay. So, like I said, things change, things move depending upon which phase of growth the plant is in or where formulation is. So, you definitely, have to be careful and be aware of that. So, I'm just saying all of that and bringing all of this up to let you know that there's a lot of cost involved with testing and who's going to pay for it. That's the bottom line. So that's why there's a lot of headache, about this because if to be honest with you, if we had have done more full panel testing, my lab would be killing it right now because not only were we testing, I was going out teaching hemp 101s. I'm doing my thing, right? So if we were doing full panels for everything that came in, yeah, that's great. But that wasn't the case. There were other laboratories, and some people were doing just potencies depending upon where they were at in the growth or the formulation of products. So testing and coverage of the cost, that's the issue.
Well, that's part of the problem that they have in Georgia too, is that the the dispensaries that came into the state, they came in with a lot of money.
Mhm.
And some of the ones that only came in with about 5 mil, they're in trouble.
Whoa, whoa. All right, somebody. I just muted you back. Remember, it's Sunday. Jesus is watching. Be careful what you say when you're off mute. Okay, there we go. Sorry, Doc. My bad.
So some of these companies came in into the state with as much as $40 million. And even they now, because of some investment problems, are now having some issues. The ones that came in with, and I thought it was a lot of money, 5 million, because of the excess costs and that kind of thing, and the lab testing and the taxes on growing and all the oversight, these guys are in trouble. And it's so I know they're fighting hard because they want to protect their space, and then you have the
Correct.
pharmaceutical industry trying to protect their space. Um, so it's hard for the guys that don't have a minimum of $5 million to get into the game, which is not
Yes,
even
sir.
enough to survive in a young state. We're young at it, even though we've been legal for about 5 years. We don't have dispensaries for 3 years. We're still very young because the educational piece has been so slow in developing. So
Yes.
it's an interesting space, but I love what you're doing, and the information you're giving is so important, not only to the general public, but it's important to providers like myself. So I appreciate you being here.
Well, thank you so much, Doc. And I really want to hear from you. I want to hear from you on email tonight. Like, send me that email. I want to get you some information. And you touched on a key point about lack of education. I need to be out doing more of what I'm doing right now, to help that piece come along. And I want to. It's just that I don't have the wallet, for it on my own. But one point I wanted to wanted to talk about real quick before we get away from this, just to show you how the difference. If you're going to go and get a hemp license, I've been in multiple states, right? And I have yet to see a hemp license, to grow or formulate or whatever. I have yet to see one cost more than $500 to $700 for hemp. Now, when we go above 0.3% and we go psychoactive, I've seen those fees go as high as $20,000, $30,000 for that license to be able to do things like that. Okay. So can you imagine pardon my French, the shitstorm that's going to be created the minute that they take Delta 8 and move it over here to psychoactive? Now people's fees are going to go up for getting licenses, maintaining licenses, renewal of licenses, things like that. People are pissed. They don't want to pay that. So yeah, they're gonna fight tooth and nail to keep it here versus move it here. I'm not speaking for or against. I'm just saying that I understand both sides of the coin and the middle So that's why I try to preach a message of truth and neutrality, and try not to be the bad guy too much on either side, you know? So that's where we're at, guys. Excellent questions, man. I was not expect. I mean, we're way over now. Like this is supposed to be from 6:30 to 7:30, right? We're still here. I love it. Does anyone else have anything else before we disconnect? Because, like I said, I want to make sure you guys are. I want to make sure everybody's getting their money's worth because I know all of y'all had to pay a whole bunch of money to come out here and get all this free information tonight. I'm joking. Um, does anybody else have anything else before we disconnect? I'm looking at all the muted microphones. I'm not seeing anyone unmuted. Going once, going twice. Guys, thank you so much for coming out here. It has been my honor. If you are not on one of my hemp growers pages, please, you can send me an email and I can let you know because I have hemp pages for 28 different states. Do your friends a favor. If you know people in other states, add them to the pages as well. Send me an email. Once again, james@jjgro.com, and I will make sure you get added to the appropriate hemp growers page for the states that I have so that we can keep funneling information out to you guys. And yeah, let's just keep everybody connected, keep moving forward. These are great times, guys. Don't give up on this space, keep going. But man, you got to go forward, within the guidelines and the rules, because if you don't, you're going to get bit one way or another. So those of you that are making great money on Delta 8 now, save it. You might need it for attorney fees later on. That's all I'm saying. We got someone raised their, oh, okay. I see Amy raised her hand. Okay, let's lower her hand and let's see if we can unmute. I cannot, hey, Amy, I cannot unmute you on my end.
That was an accident. I'm sorry, but I've really enjoyed it.
That's okay, classmate. I'm very glad to hear your voice, and I am very glad you made it out.
Yes, thank you so much.
You are so welcome. And if you need anything else, girl, let me know.
Okay, thanks.
All right. Well, guys,
Bye.
I hope y'all have a great evening. And if I can be of any use to you in the future, like I said, shoot me an email and let me know. And I hope all of y'all have a great evening, and we'll see y'all here next time. Y'all take care. Bye-bye.